As a fertility specialist, I come across patients who have history of failed IUI or failed IVF, and they have a question which needs answer. The question is, how many times can we do an IUI or IVF? So I'm Dr. Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Today I'm going to explain you how we decide about the number of IUI cycles and number of IVF cycles that one can consider. So legally there is no limit in India about the number of IUI or IVF cycles, but we have to see medically. If somebody is undergone IUI cycles 4 times, then what we call it as cumulative pregnancy rate goes up to 60%. Beyond that, if you continue trying IUI, it may not work for you. But per cycle success for IUI is around 15 to 20%. Also, what is more important is age of the woman and the factors which are causing infertility. If there is a simple factor like cervical stenosis or mild male factor infertility in a young female patient, then the success rate of IUI for her can be up to 25%. But the same success rate for a woman above 35 years may drop down to 5%. Also, we have to see if there is severe male factor infertility or there are multiple factors like fibroid uterus, endometriosis, thyroid, diabetes, high BMI. All these factors also contribute in the success of fertility treatments. So such patients we don't advise to go for repeated IUI cycles, as the success rate will also decrease with the age, and for them cumulative success rate may not go above 20 to 30%. So now coming to IVF cycles. IVF cycle per se does not guarantee success. Most of the patients have this belief that if they are undergoing an IVF, it has to come positive 100%. Sometimes they ask me for guarantee. So what we have to understand is IVF is in science. It is not a miracle. So it is same like IUI, we have to consider the cumulative success rate. For IVF, the cumulative success rate after 4 cycles can go up to 70 to 80%. So it depends again on age of the woman. Most importantly, for younger women, it will be higher side success rate. For women above 35 years, the success rate drops significantly. Even in IVF, in women more than 42 years of age, the success rate can drop down to 5%. But there might be exceptions. So your case is different from somebody else's case. So do not compare your results or your treatment with some other patients. IVF success rate also depends upon the skills and experience of the clinician, the lab setup, the advanced technologies that are being used for doing your IVF. All these things will definitely affect your IVF success rate along with your general health. So what is in your hand is optimizing your health by keeping your other medical conditions under control, going for treatments in time rather than waiting too long, and selecting the center and doctor wisely, and stick to their advice to optimize your success rate. I hope this was helpful. Thank you.